Are you always feeling thirsty, no matter how much water you drink? This could be a warning sign that something's not quite right in your body. Many people ignore small changes in their body, thinking they're just a normal part of life. But what if these changes are actually early signs of a serious condition, like diabetes? Diabetes is often silent in its early stages, with symptoms that can be easy to ignore or brush off as nothing serious. But ignoring these symptoms can lead to serious complications down the line. So, what are these early signs of diabetes that you should never ignore? Let's start with one of the most common, excessive thirst. When you have diabetes, your body is not able to regulate its blood sugar levels properly. This causes your kidneys to work overtime to filter out the excess sugar, which in turn makes you feel thirsty. But why does this happen? It all comes down to the way your body processes glucose. Normally, your pancreas releases insulin to help your cells absorb glucose from the blood. But when you have diabetes, your body either doesn't produce enough insulin or can't use it effectively. This leads to a buildup of glucose in the blood, which can cause a range of symptoms, including excessive thirst. And if you're experiencing excessive thirst, you're likely also experiencing another common symptom, frequent urination. Frequent urination is another early sign of diabetes that's often ignored. When your body is trying to get rid of excess glucose, it will try to flush it out through your urine. This can lead to a vicious cycle of drinking more water, which in turn makes you urinate more. But it's not just about the frequency of urination, it's also about the amount. If you're producing large amounts of urine, it could be a sign that your body is trying to get rid of excess glucose. And this is where another common myth about diabetes comes in. Many people think that diabetes is only caused by eating too much sugar. But that's not entirely true. While eating too much sugar can contribute to the development of type 2 diabetes, it's not the only cause. In fact, there are many other factors that can increase your risk of developing diabetes, including genetics, obesity, and physical inactivity. So, what can you do to reduce your risk of developing diabetes? Let's get back to those early signs. Another common symptom of diabetes is fatigue and low energy. When your body is not able to use glucose effectively, it can lead to a range of problems, including fatigue and low energy. This is because your cells are not getting the energy they need to function properly. And if you're feeling tired all the time, it can be hard to motivate yourself to do anything, let alone make healthy lifestyle changes. But it's exactly these changes that can help prevent diabetes from developing in the first place. Blurred vision and slow healing are two other early signs of diabetes that should never be ignored. When your body is not able to regulate its blood sugar levels, it can cause damage to your blood vessels and nerves. This can lead to a range of problems, including blurred vision and slow healing. And if you're experiencing any of these symptoms, it's essential to see a doctor as soon as possible. So, why do these symptoms happen? It all comes down to the way your body processes glucose. When you eat, your body breaks down the carbohydrates into glucose, which is then absorbed into the bloodstream. Normally, your pancreas releases insulin to help your cells absorb glucose from the blood. But when you have diabetes, your body either doesn't produce enough insulin or can't use it effectively. This leads to a buildup of glucose in the blood, which can cause a range of symptoms. But here's the thing, many people ignore these symptoms, thinking they're just a normal part of life. And this is where the risk of late diagnosis and complications comes in. If you're not diagnosed with diabetes early on, you may not receive the treatment you need to manage the condition. And this can lead to serious complications, including heart disease, kidney disease, and nerve damage. So, what can you do to reduce your risk of developing diabetes? The first step is to get tested. If you're over 45, or if you have a family history of diabetes, it's essential to get tested for the condition. And if you are diagnosed with diabetes, there are many things you can do to manage the condition, including eating a healthy diet, exercising regularly, and taking medication as prescribed by your doctor. In conclusion, the early signs of diabetes are often silent, but they should never be ignored. Excessive thirst, frequent urination, fatigue and low energy, and blurred vision and slow healing are all symptoms that could be warning signs of diabetes. So, if you're experiencing any of these symptoms, don't ignore them, see a doctor as soon as possible. And remember, early detection and treatment are key to managing diabetes and preventing complications. To summarize, the key takeaways are: be aware of the early signs of diabetes, get tested if you're at risk, and take action to manage the condition if you're diagnosed. And if you want to stay up to date with the latest medical knowledge and tips, be sure to follow Easy Medics Daily. We'll be posting new videos every week, covering a range of health topics, from nutrition and fitness to disease prevention and management. So, subscribe now and join our community of health-conscious individuals who are taking control of their well-being.